we welcome you all to the Multi-Medix webinar series on ultrasound quality assurance. This is the final webinar in our series of 4, and tonight we're going to be rounding things up, refreshing ourselves on what we've learned in the previous 3 webinars, and just talking about how we can put things into action as well. Now, don't worry if you haven't seen the previous 3 webinars. This webinar almost acts as it could almost act like a bit of an introduction, and it'll give you some inspiration to go back and watch the recordings, which are all available on our online knowledge portal. My name's Marilla Stevenson. I work for Multi-Medix, and I just want to take you through a few administrative points first of all. If you can keep your cameras switched off, that will prevent any lagging issues that there might be. If you leave questions to the end as well for the final 10 minutes, and if you can ask those through the chat panel. Tonight's webinar will be recorded and it'll be on the online knowledge portal by about lunchtime tomorrow if you want to watch it again. And if you have any issues with audio or technical issues at all, I will sync into the background and hand over to the real hosts in a minute. But I'll put my email address in the chat panel so you can email me if you've got any questions, queries. So our presenters tonight are Darren Woolley, Dr. Nick Dudley and Gill Harrison. Nick and Darren may well be familiar to you because they've been on the previous 3 webinars. Dr. Nick Dudley is an ultrasound physicist. He's written over 50 peer-reviewed publications and he's contributed to ultrasound guidance both in the UK and in Europe. And Darren Woolley has 25 years of maintaining and managing medical equipment. He's a leading authority on ultrasound probe testing and identifying counterfeit and unsafe probes. And he's the technical director for Multi-Medix. And tonight, our guest is Gill Harrison, and she's professional officer for ultrasound with the Society and College of Radiographers. She has over about 30 years experience as a sonographer, and she's going to be telling you a bit about how implementing QA programs can form part of CPD. So this webinar series, we've covered things like baselining, so that's setting up all your user presets. We've been doing some user QA and demonstrating how to do the user QA, and those live demonstrations are available on the previous recordings. We've been looking at audits, what to look for, when to do audits, so the whole QA process. And hopefully as well, we've dispelled a few myths that actually QA can take minutes to do. So as with the previous webinars, I'm going to ask a question. I've got a poll set up for you just out of interest, and it's an anonymous poll, so you know you're not going to be named and shamed or anything like that. So the question is, and although it says here in the last 7 days, I'm going to ask it as though it's from the beginning of the webinar. So over the last month, since these webinars have started, have you done any ultrasound user QA? So, and that means anything. That means downloading the book, looking at the probe, unknitting the cables, you know, that might be around your system, anything at all. Because many people have said to us they were doing no QA or very little QA beforehand. So it's always interesting to see what if people have done anything since the webinars have started. I'll just give it another 5 seconds or so, let people get a chance to find how to submit their answers. And yes, 100% of people said that they've had a go at least. So that's brilliant. And hopefully as well, after today's session, you'll be encouraged to do even more. So now that we've had a look at that, let's get on with the webinar itself. I'm going to hand over now to Darren and Nick first of all, and they're going to kind of recap a bit on ultrasound quality assurance and the whole process. Thank you.
Thanks, Marilla. That's a great intro. Just going to bring in Gill and Nick. There we go. We're all here. So welcome, everybody. So I think it's a good thing for us to start this evening with just a little recap of what we've learned over the last couple of weeks. And I think the most important question to start with is where we started the journey was why is ultrasound QA important? And I think Nick's going to refresh us on that, please, Nick.
Yeah, thanks, Darren. Hi, everyone. Well, contrary to popular belief, there is a legal requirement for QA. The Health and Social Care Act requires that we look after our equipment and make sure there's no more than minor deterioration. So we should be doing something to show that. Also, a few years ago, Darren and I did a survey in 12 hospitals, and we found that 1 in 3 probes were faulty and 1 in 8 probes weren't really fit for purpose. So the absence of QA means that patients are being put at risk. And that brings me to the final point, which I keep making in every webinar, that the centre of all this is the patient. It's our duty to protect the patient. So we should make sure that the equipment we're going to use on them is safe to use.
So Nick, I'm going to coin the phrase that QA is mandatory, and it's pretty much the only way that we absolutely know the machine's performing as intended on a day-to-day basis.
Absolutely right.
So I think one of the things I've experienced, Nick, as well, which is also important, is what it brings to the sonographer and user of the machine. Is I've been working closely over the last year with a lot of departments and sonographers, and they're telling me they just feel a lot more confident that their imaging equipment is working as intended. So that gives them kind of a lot more confidence in their day-to-day scanning. I hear things like it's just giving them peace of mind, and they feel more empowered to identify defects early and do something about it. So I think that's great. I think also they've picked up on the system of QA that we've been working on, and Nick, you've really been a driving force for. The simplest of tests are detecting the defects that we talk about, which are making patients safer. So what are those components, Nick, that make up this QA system that we've talked about?
Well, there are quite a few components, but you don't have to try to do them all at once. So firstly, with any new equipment or repaired equipment, you need to do some acceptance testing, and that's going to include safety, integrity, function, uniformity, and ideally some sort of accuracy measurement. And at the same time, if you're going to do any quantitative measurements, you need to do some baseline testing to set some tolerances for those measurements. And then for routine testing, the user should be the center of that, but perhaps annually you might need some support to do some more comprehensive testing. And then, of course, if you're testing and finding faults, you've got to take action when you find a fault. And to pull the whole system together and make sure it's working, you need audit. But as I said, you don't have to do this all at once. What I would suggest you do to begin with is focus on the easy things that detect the most faults. So if you handle and clean the equipment carefully, that's going to prevent faults. If you do an inspection for damage and wear, which you can do very quickly every day, that's going to detect some of the more major faults. And also checking inner uniformity is a quick test. So if you just do these very simple things that only take a few seconds per probe, as Darren said, you should be able to detect over 90% of faults.
So Nick, we now understand on the series of webinars and what we've just recapped on why we're doing it. Just refreshes on when we're doing this, just to make it really clear for everybody.
Right, the tests are very simple. So I would suggest you have a formal program that is perhaps monthly, but you can actually do QA every day. When you go into the ultrasound room at the beginning of a session, if you just spent 30 seconds per probe, having a look for damage or wear and pressing the user QA preset button and looking at the inner uniformity, you're going to be sure that your scanner's fit to use on that patient.
Great, thanks for that, Nick. So we're going to bring Gill in very shortly. And I'm delighted that she's joined us today because we get a perspective from a sonographer, not just from myself and Nick. We've chatted with Gill in the past, and one of the things that we think is very useful is that we're trying to deliver with the QA program a really simple, standardized set of instructions that can be used and shared across trust to trust and people can move from different departments or different hospital groups or in and out of the NHS and have a very standardized way of doing QA for the profession. I think it's a great opportunity for people that haven't engaged with QA to do it before, and I think Gill's going to talk about how that might help with CPD. But before we do that, I know Gill's looked at the manual, and I also know that she's been watching some of the webinars, so she can critique us now and share any thoughts she's had over the last kind of few weeks. So if you want to start, Gill, there, and then we'll talk a bit about CPD.
Thanks, Darren. I think the key things I've learned, and certainly one of the things is that how much damage you can do with paper by wiping the probes with paper.
Yeah.
The importance of user testing every day is crucial, but also how many defects you can find by doing really simple tests. I think that was a shock to me, how much the sonographer on the ground can detect within that 30 seconds that Nick's just mentioned. And the other thing that I've really found is how simple it is, but also how important a paperclip is. I never realized just how important it would be.
Good point. Good point. So Gill, we know you're a professional officer for SCoR, and you work very closely with the profession and developing the profession and their continual development. So talk to us about CPD and how the QA and implementation and use of the QA fits into that for the professionals.
Okay, I'll just share my screen and hopefully this should work. Okay, so I just really wanted to give a very brief overview of how CPD can be integrated from watching these webinars or looking at the manual, because actually the first thing I did was look at the manual. And it's really quite straightforward. Is first thing to do is what actually have you learnt from these webinars? Then you need to think about, well, what does that mean to my practice? How do we do that? Do we do QA? If we do, are we doing everything or are we missing some bits out? And then you think about, well, now what does that mean? It might be that you are doing everything, you know, and everything that Nick and Darren have said so far, you think actually we're doing that. So it might be a case of saying, well, how do we make sure we carry on doing that well? Or you're looking and thinking, actually, I'm not doing all of this, or our department aren't doing this. What can we do to improve? And then you need to start to develop SMART goals. And the first thing is specific. Is a QA system in place for your daily checks? And QA every day might be the thing that you want to set up for all your ultrasound machines. So the next thing you need to do is see, well, can I measure that outcome? And you then have to think, well, if I'm going to do this QA every day, how am I going to prove that it's been done on every machine? So you might want to think about whether you're going to have a book on each machine, whether you'll have a chart on the wall, or whether you'll have spreadsheets on a computer. But that's a measurable outcome then for your goal. You then need to think about, well, is this achievable? How am I going to make sure that everybody knows what to do? And how am I going to check that they're all actually documenting what they've done and doing it properly? You've also then to think, well, is this realistic? And the initial specific goal that I gave was QA every day on all ultrasound machines. That might be appropriate if you work in a small vascular unit or a general medical ultrasound department, but if you're thinking about QA every day for every single machine in a big teaching hospital or a huge department, a huge centre with machines in cupboards that you don't even know exist, that might not be realistic for now. So have a think about what's realistic to start with. And then you need to set a time frame. So you make sure everyone's trained, everyone knows how to document it, and then you're going to monitor whether that's worked. If you do that for a small part of the department first, you can then spread that out and gradually you can achieve it in the whole trust, but it will take a little bit longer. What you then need to think about is how are you going to evidence your learning? And you'll all learn something different from these webinars. I've learned loads, but I'm not going to implement it in the same way as somebody who's in clinical practice. I'll be thinking about how can I link this into national guidance. So if you're a Society of Radiographers member, you might have CPD now. If you're an IPEM member or you're on the RCT register, you might have used their portfolio for evidence. You might use a different type of e-portfolio, or you might have a paper-based portfolio of evidence that you reflect on. So everything that you're thinking about in terms of what have you learned, how does that work in relation to your practice, and how are you going to make changes to improve patient safety and the quality of the examination that you're going to perform is really important. And if anyone ever looks at CPD evidence, they want to know you've got some outcome that's going to impact on your practice and for your service users. So thank you for listening. I will stop sharing. Press the
Thank you, Gill. I think that was very well put and very helpful. So is there anything else you'd like to just add about the QA program, good practice with QA, or the CPD? Nick, any reflective thoughts on what Gill said?
Yeah, I thought that was very useful, Gill, and you've said things that we haven't said while we've been talking about the QA, which is always useful to have another perspective. But coming back on the realistic part of the SMART objective, I should just say that we're not asking one person to look at 100 scanners every day. We're asking one person to look at one scanner. And spend maybe 4 or 5 minutes before they start scanning, having a look for any signs of damage or wear or non-uniformity. So, I mean, there may be a paperwork element to that, but it's possible to implement that tomorrow if you're not going to worry too much about the paperwork at the beginning. And the other thing I'd just like to add is that it would be really good to give this tool to sonographers from day one. So if we could get the higher education institutions to pick it up and incorporate it in their training, that would be fantastic. I'm not sure how we go about that.
Certainly in terms of the case accredited programs, we already have learning outcomes that are mapped for a program, and quality assurance is part of that. So it's certainly something that should be in a case accredited program, but obviously there's lots of other training going on with a whole different range of professionals. And I think that's where we need to think about how we can implement that wider. And certainly putting the guidance into the SOR and BMIS guidelines for professional practice, I think will help to spread the word.
Great, thanks guys. I think timing's perfect there. So I know Marilla's keen that we end our webinar series with another quiz to see if any of the participants can get the answers right. I'm not afraid to say that Marilla tested it on me and Nick earlier. I'm not going to tell you how we scored, but Marilla will come back in and we'll have that last little quiz, and then we'll open up the floor to some questions.
Okay. Right. So yeah, I have got another poll. So again, it's all anonymous. I'm going to launch it, and I know that sometimes for those people that are watching the recording, the questions don't always come up on their recording, so we'll read out each question. So the first question with just a yes/no answer is QA mandatory? The second one is how often should QA be done? And this is a multiple choice, as in you can put in more than one answer into that one. Third is annual independent audit necessary? Fourth, do you need a phantom for ultrasound user QA? And according to research, what percentage of probes were found to have faults? This is the piece of research that Nick and Darren were talking about earlier on, that when they went and kind of did a study and looked at what probes there were in the department. What percentage of probe faults can be spotted by doing quick daily QA checks? And then how likely are you to start a QA program in the next 6 months? So I'll give you a little bit of time to fill those in. I'll give you another sort of 10-20 seconds or so, give you all a bit of a chance to read them through. And if anybody also wants to start writing some questions in the chat panel as well, I can see there's a couple in there already. But I can give you an opportunity to do that too. I think most people have voted. Okay, so I will call that a close now. Okay, so is QA mandatory? Yes, it is. Yeah, and everybody's got that right. How often should QA be done? Everybody said every day. Yeah, absolutely. It is also, there are also some monthly and annual checks. So the annual audit as well forms part of the overall QA program. But yeah, it should be done every day. Is annual independent audit necessary? Yes, everybody's got that. Do you need a phantom for ultrasound user QA? The answer there is no, actually. If you want to do some further detailed testing with some of the results that you've got, some of the initial results you've got, then yes, you may want to use a phantom, but you don't need to use it for the user, sort of daily user QA testing. The number of percentage of probes that were found to have faults when a research study was done was actually 33%. Luckily not the 50%. What percentage of probe faults can be found by doing quick and daily QA checks? We have pushed this percentage quite a lot on the webinars, yeah, 90%. So those quick and easy checks that you can do every single day will actually pick up the vast majority of faults there might be out there. And it's really good to see that most people are going to try and implement some form of QA program. It may well be that some of you out there have already got a QA program, hence the reason why not applicable was in there, and you're just carrying on the good work that you're already doing. But it's really good to see that many of you are going to be able to start a QA program. So I'll just share those results quickly so you can see them. Just scroll down. Good, thank you very much indeed. Is there anything, Nick and Darren, you want to add to those quiz results? I've explained everything correctly. Yeah, okay.
I think you've done a brilliant job, Marilla. Thank you.
Right, so questions in the chat panel. So Henry has asked if we offer any training for QA.
Yeah, we certainly do. Depending on requirement, we can certainly work with Henry to understand his needs and his team or department's needs. I think I would also add to this is when I recently trained a smallish team of sonographers in an NHS hospital, they were very nervous on the day of training that I was going to lecture them on physics. And we don't put any heavy physics into the user training, and we make it very accessible to them. It was like a weight off their shoulders. You should have seen them. They came in heavy with worry, and they were light with relief when we actually got into what we were doing. You know, so I'm delighted to say that that's an important aspect of when we do training with the users.
Good. Okay, thank you very much. Has anybody got any other questions at all? We've had a few thank yous in the chat panel, which is lovely. Thank you very much. Did anybody else want to ask any questions? No. Oh, got one more message. About 20 colleagues. Wow. Okay. And sister hospitals. Yeah, we've done training courses for groups that large, so that's not yeah, that's not beyond what we can do at all. Yeah.
Yeah. No, we'll be able to discuss that after the webinar, won't we, with Henry?
Yeah,
great.
Absolutely. Yeah.
Yeah.
Yes,
So,
hello.
Hello, Henry. Hi.
Yeah.
hello.
Sorry. I am joining you from the unit, and I was on duty, and I joined the webinar very late. But I have other colleagues who are in the sister hospital. We are a mission-based hospital in Cameroon, and I would like my colleagues to have this training. How can we organize this training?
I can contact you, Henry. We'll get in contact with you after the webinar, and
Yeah,
we'll get something set up.
Yeah, if you email with Marilla, Henry, we will set up a dedicated session.
Yeah, I will do.
Yeah.
Yeah.
And then we
in
can
fact,
talk.
I came and did some QA in my system, and I saw that.
Oh no!
This our probe. Actually, it is bad, but we are still managing with it. So we are going to make a requisition so that it can be replaced.
Good.
Oh, that'd be great.
Good.
Okay.
So,
okay.
As a general point,
Yeah.
Marilla, it's probably worth saying if anybody's not certain about something that they want to ask today,
Yeah.
or they watch the webinars later, please do contact us with any questions. We'll be delighted to get back to people with specific answers. It's quite difficult to be generalized on a webinar for everybody today, but yeah, absolutely, we can get back and answer questions. So Marilla, I think you've got your email address there, or people can find our other email contacts on the website. Yeah,
absolutely. Yeah. Okay, so we're at the end. So and it's the end of the webinar series as well. So thank you very much to Gill for joining us this evening, and for Darren and Nick for your expertise. I don't know if you guys have any final words you want to give.
Yeah, I'd just like to say thanks to Gill for joining us tonight. And thanks very much to Multi-Medix, in particular Darren, for supporting me in writing the QA manual. I certainly couldn't have done it without the support of Multi-Medix. And also you'll see some of the tests in the manual are quite new, particularly the ones for phased arrays and multi-row arrays. And I certainly couldn't have developed those without the support of Darren and Multi-Medix. So I'm really grateful for that. Thank you.
And Nick, I'm just delighted that we've been able to work as a team on this, and certainly we're now beginning to share that, which is also fabulously important to us. And I'd also like to echo thank you for Gill. It's been nice to have someone that actually uses the machines
Thank you.
and represents the professionals that use the machines. So we're not just in a little echo chamber of talking about QA. We've got some additional insight, which is very helpful. So thanks again, Gill.
Thank you to both of you and Multi-Medix for actually developing this, because I certainly spent years trying to fathom out some test tool that didn't make any sense, and this is just so simple. It's brilliant. Thank you.
Great. I think that's a great way to end. Marilla, thank you for hosting us and making this all happen.
Thanks. You. Good evening, everybody. Thank you very much, and happy QAing. Bye, everybody. Bye.
Bye-bye.
Everyone.